This week on Intermediate English, we've got an interview with Henry Laurenson-Schafer, who works with the World Health Organization in Geneva to try and understand and combat the coronavirus. I think it's a really interesting interview and I hope you find it informative as well. All of the views presented are his own and not those of the WHO. Hi, Henry.
Hey, Ben.
Could we start off by just maybe talking a little bit about what you do and what your job is?
So my job currently is I'm working with the World Health Organization in their COVID response team.
Mm-hmm. So a team that's responding to coronavirus, also known as COVID-19.
Exactly, yes. So this is a team that has been in place since the start of the emergency, since it was notified to the World Health Organization. Mm-hmm. And it's been developed ever since.
Okay, great. Could you tell me a little bit about what the World Health Organization actually is?
Sure. So the World Health Organization is a organization that falls within the United Nations, but is in a way sort of separate or off to the side from the main activities of the United Nations. Mm-hmm. And there are other such organizations within the United Nations that are similar to this. There's the International Labour Organization, for example. Or UNICEF is probably the most well-known of them.
Okay. So it's part of the United Nations, but slightly separate from it as well.
That's right. So one of the most high-profile activities that goes on with the United Nations is the General Assembly, which takes place sort of in the autumn time. And one thing that we have with the World Health Organization is for about 2 weeks every year, we have the World Health Assembly, which is like our miniature General Assembly, where all of the nation states or the member states of the organization that make up our governing body come together and decide on our program of work.
Okay, so could you tell me roughly, the basics about the WHO, the World Health Organization? Where's it based and how big is it?
The World Health Organization is the headquarters is where I am currently. That's Geneva in Switzerland. But it's also split among 6 different regions around the world. And there are regional headquarters for the World Health Organization. And those regions are designed to more closely be able to liaise with countries or the member states of the World Health Organization.
So there are particular headquarters that are placed around the world to deal with the different countries that make up the United Nations.
That's right, yes. And there are even country offices. So a lot of countries have specific World Health Organization offices for their own country completely.
Could you tell me first a bit about your background as a scientist and how you ended up working for the WHO?
Sure. So I previously to working here was an academic, or rather I was a PhD student. So I was working on a PhD in the United Kingdom, and my PhD was focused on flu virus, influenza virus, and its interactions with human immunity. And I was specifically interested in how human genetics could impact how we fight, how our immune system fights influenza virus.
What made you want to become a scientist, and what specifically made you interested in this area of science?
It's a little difficult to say, but I've always been very interested in life sciences specifically. I think there's a lot of very fascinating and complex interactions that happen within even the smallest microorganisms. And I think, yeah, that just has always fascinated me from a young age. And this has sort of slowly led me down this path.
So you've said a little bit about what your role is in the WHO. Could you go into a bit more detail and tell us what exactly it is you do, or at least what you were doing until this year?
Until this year, I was working on behalf of the Global Influenza Program, which is an aspect of the World Health Organization that is specifically concerned with influenza. Mm. And this is a very long-standing program within the World Health Organization. And what it's most well known for is convening 2 meetings every year in which the types of influenza virus that will be used for the vaccine that year are selected.
Okay, so you talked about a vaccine, and a vaccine is probably something that a lot of people are familiar with and a concept that a lot of people know. But can you just explain a little bit about what a vaccine is and how that works?
Sure, yeah. So there are many different kinds of vaccines, but in general, the idea behind a vaccine is that you can somehow expose someone, like me, for example, to something that looks very much like a naturally occurring virus. So, for example, we might expose someone to a small part of a virus that's been killed. Mm-hmm. And the idea behind this is that we all generate immune memory to viruses that have infected us. And this can hold for a short amount of time or a long amount of time, depending on the virus and depending on how it evolves. But functionally, this will at least hopefully give you short-term or long-term protection from being infected with the virus.
So basically, it's an injection which injects a small part of a virus, and that allows you to develop your immune system, in other words, your system that allows you to fight off disease, and therefore to become better at fighting off that virus. Is that a fair summary?
I would say that's similar, but not exactly what the situation would be. Mm-hmm. So firstly, a vaccine doesn't have to be injected.
Okay.
There are some cases where you can take a vaccine orally, for example.
Right.
And it doesn't have to be a part of a virus either. It can actually be a full and activated dead virus. It can be part of a bacterium, not a virus at all. Uh-huh. It could be, in some cases, it could be a version of a virus that's very weak and your immune system can easily fight.
So we're talking about vaccines for flu. Are vaccines for flu used all around the world or only in certain places?
So they're used sort of to different extents all around the world. And every country tends to have different policies when it comes to giving people influenza vaccines. Mm-hmm. And some countries will make the vaccine widely available, and some will try to target it towards individuals in society who would be more vulnerable to getting severe influenza virus infection, such as the elderly. In addition, the vaccine isn't the same all around the world. So there's one vaccine that's made every year for the Southern Hemisphere and one vaccine that's made every year for the Northern Hemisphere, because influenza virus circulates mostly in the wintertime. So when it's winter in the Northern Hemisphere, where we are, it will be summer in the Southern Hemisphere and vice versa. And in those 6 months, often the virus has had a chance to change or mutate to a large enough extent that a new vaccine is needed. And so that's why that's why new recommendations for the vaccine strain are made every 6 months.
So up until now, we've been talking about the flu, influenza, but 2020 is the year that coronavirus, also known as COVID-19, became a pandemic. So it became a virus that was spread globally. Could you tell us a little bit about coronavirus? Do we know how it started, for example?
That's a good question. So the exact origins of this new coronavirus, which the name of the virus is actually SARS-CoV-2. There's a distinction that we have between the name of the virus and the name of the disease. So in this case, the disease is COVID-19, which you get when you're infected with SARS-CoV-2.
Okay.
In terms of the origin of the virus, it's still, there are many things that are known, obviously, but there are also many unknowns. But what tends to happen with viruses like this, like a completely new virus for humans, humans haven't encountered it before late 2019, at least we think, or it hasn't spread widely among humans since then, we'd imagine, is that they are a virus that is normally infecting animals. So some specific animal has this virus normally circulating in its population. And then in some rare event, it's able to jump hosts and infect a human. And in more rare events, that virus is able to live in humans and infect them and actually spread from that human to another human, and so on and so forth, which is what happened with this new virus. And we know that this virus likely came from what we would call a wet market in Wuhan, China, from some contaminated source, the origin of which is currently unknown.
Okay.
Although there have been efforts to look at the genetic sequence of the virus and compare it to viruses that are circulating in local wildlife, let's say, to try and pinpoint the animal that it might have spilled over from.
But the results of that presumably haven't come in yet. The results are inconclusive.
I would say as of yet they're inconclusive. It seems likely that its animal reservoir is a bat at this point. However, it also seems likely that it wasn't directly spread from bats to humans, and that there was actually probably an intermediate animal that was infected in this case. Mm-hmm. Although this is, again, not known for certain at this point.
Okay. Could you tell us how coronavirus is different from diseases that we're more familiar with, like the flu or common cold?
That's a good question as well. So from the perspective of a virologist, these are all viruses that live in different families. So the influenza viruses are all they're all a family. You can link them very easily through evolution. What's interesting about your question, actually, is there are other kinds of coronaviruses that circulate in humans all the time, and they can cause the common cold. However, humans had never previously, or likely hadn't previously, been exposed to this specific species of coronavirus. Or species isn't the right word, I don't think, but this type of coronavirus.
Right. So coronavirus is actually a really big family of diseases, and the one that we're dealing with now is just one example of that.
That's right. There are 7 known coronaviruses that infect humans, and 4 of them are normally circulating. There's this new one, so that makes 5. And then there's also 2 coronaviruses that don't regularly infect humans, but have been known to cause outbreaks. And those are SARS, which had a big outbreak about 15 years ago or a little more. And then there's a virus called MERS, or MERS coronavirus, which has sort of regular small outbreaks.
So most people have some idea of what coronavirus is like if you get it. But if someone didn't know what the disease is like, could you give some idea of what that might be?
So the most common symptoms when you're infected with coronavirus are a dry cough, a fever, and people often feel quite tired as well. And interestingly, one of the symptoms that was reported later in the outbreak was a symptom where people often lost their sense of taste and smell.
Okay, and is it the case that coronavirus affects certain people more than others?
Certainly in terms of severe outcomes to the virus, yes. What we've seen so far is that children, especially young children, don't seem to be very affected at all by coronavirus, except in some rare cases.
Mm.
And on the flip side, the elderly seem to be affected much more severely by this virus than younger people. Sorry, I can also add to that there are a number of medical conditions that seem to be associated with worse outcomes to infection with coronavirus as well, in addition to age.
What might those conditions be?
Again, there is a very long and exhaustive list, and I don't have them to hand, so I don't want to get anything wrong. But some of the more common ones would include obesity, cardiovascular disease, so heart disease.
Is there a simple way to explain how a virus actually operates and how it spreads from person to person?
Simple, I can try. So a virus is sort of like a little, it's like a little machine. So these are very tiny little, I don't know if you'd call them microorganisms or not, but they're very small particles, and they infect humans, usually in specific areas of the body or specific tissues. And then the way that a virus works is it needs to exist inside of a human to make more copies of itself, to replicate. So for a virus like SARS-CoV-2, which is causing COVID-19, this virus would replicate among other tissues in the lung. And so this virus would infect your lung cells, and then within cells in your lung, it will sort of hijack or steal the cell's normal machinery and use it to create more copies of itself. And then eventually that cell will die and release many copies of that virus. And this is how,
This is how, sorry.
And this is how you'll get a buildup of viruses in your body, and how,
How does coronavirus compare to previous public health crises?
That's a good question. It's kind of difficult to find very good comparisons to this one, in my view. One of the most obvious comparisons to this, to the coronavirus outbreak, is the SARS outbreak. And this again was a case of a coronavirus that had quite a large outbreak and spread to multiple countries. Although in this case, in the SARS outbreak, the virus was curtailed before it could spread fully globally.
So it was stopped from spreading?
It was, yeah. And that's why we don't really see any SARS today.
Yeah.
However, this is not the case for COVID-19. So this has now become a global event. And so perhaps one of the best, but not perfect comparisons to this disease or to this pandemic would be previous pandemics of flu. And so there have been a few of these in the past 100 years. The most recent of which would have been the 2009 swine flu outbreak. This again was a disease that spread globally. However, the mortality rate, or the chance of death when getting infected with swine flu, or with H1N1 as we call it, was much lower than we expect from COVID-19. Perhaps a better comparison would be the so-called Spanish flu from 1918, which was another influenza pandemic, but this time with a much higher mortality rate than other strains of flu that we see circulating. And so this event truly did have a massive global impact, and is actually estimated to have killed more people than died in the First World War. Mm-hmm. It's, however, important to note that the world of 1918 is very different to the world of today, and a lot of comparisons about how the disease spreads aren't, especially in the global context, aren't really the same. We have huge numbers of planes flying all around the world every day, which just wasn't the case back in those days. And these are really the driving force between by which the virus is spread around the world.
So the intercommunication between different countries and different people today means that a virus is able to spread a lot more easily than it did in the world of 1918, 1919, where there was less travel and maybe less physical contact.
Well, in some ways, yes. But in other ways, in 1918, our understanding of viruses was basically nothing compared to what we know now. So while we are now much more connected than we were in the world of 1918, we also know a lot more about how to stop the spread of viruses, and we have much better medical care as well. So these things all, I wouldn't say they balance out, but they're not comparable in either sense, I would say. Mm-hmm.
I want to ask you a couple of questions about the future of the virus. And I understand that this is very speculative, and that, in other words, we don't necessarily know everything that there is to know about it, and that there's a bit of guesswork involved. But is there a cure for the virus, and can we find a cure for the virus?
So when we speak of a cure for the virus, we would likely be talking about one of two things. The first of which would be a vaccine for the virus, and the second of which would be some form of medication that we could take to, once you had the virus, or maybe even before you had the virus, which would reduce the effects of the infection. And when it comes to the vaccine, there's a lot of work being done at the moment to try to create a vaccine for the coronavirus. However, there are no vaccines as of yet. When it comes to medication, there have been some somewhat promising trials, although there's been no, let's say, silver bullet, if you will, medication.
So nothing which has solved this problem immediately and decisively. We're still waiting for that.
Yes, that's exactly right.
Thank you so much for speaking to us today, Henry, and for giving us your perspective on the virus and the state of the pandemic right now. And we hope to speak to you again soon, maybe when this is all over, and we can talk to you about whatever you're working on then.
Thanks very much, Ben. It's been a pleasure.
All right. Take care. Bye-bye.
Bye.